Hi everyone, this is Self Talk Sim, and I am your host, Tembele Jaka. And today we'll be talking about malaria, its transmission, signs and symptoms, and prevention. We'll start with our story on malaria. The story is about John and his wife Sarah. They traveled to Victoria Falls to celebrate his promotion. He got carried away and excited, so much that they forgot to take malaria control pills when they were traveling. And when they visited the majestic Victoria Falls, without any worry in the world, after their weekend of vacations, they returned home to their day-to-day activities. A few weeks later, Sarah started to have headaches, muscle aches, and feeling tired. At first, they thought it was just because of your pregnancy. When John started having the same symptoms, that's when they decided to go to the hospital, and they were told that they both contracted malaria. Sarah unfortunately lost the baby. According to John, it was a worst experience he has ever felt in his life, and he doesn't want anyone else to experience the same pain. So, to get on with our discussion, we'll start by what is malaria? Malaria is a disease caused by Plasmodium parasites transmitted by the bites of an infected mosquito. It invades red blood cells. It is only found in tropical and subtropical regions. Each year, nearly 290 million people are infected with malaria, and more than 400,000 people die of the disease. According to the World Health Organization, children under 5 years of age are one of the most vulnerable groups. The spread of malaria. It is spread from the bite of an infected Anopheles mosquito. After the spread, the symptoms start to show after a period of time in the infected human. And if you do not get any treatment, you either die or suffer from a mental disorder. On this slide, you can see the malaria transmission cycle. To move on, the signs and symptoms, which includes headaches, muscle aches, fever, and flu-like symptoms, tiredness, nausea, vomiting, and diarrhea. And moving on, this slide is showing the symptoms of malaria. And in this one, we are learning about the areas that are most affected by malaria. We look in the central nervous system, that is headaches. In the systematic, we have fever. In the muscular, we have fatigue and pain. And then the back, one experiences pain. And also the skin, there are chills and sweating. In the respiratory system, one experience dry cough. The spleen is enlargement, the spleen, and then stomach, one experiences nausea and vomiting. Ways of preventing malaria. Insect-treated bed nets can be used to protect people from mosquito bites. The World Health Organization has recommended a malaria vaccine for use in children who live in countries with high numbers of malaria cases. Protective clothing, bed nets, and insecticides can protect. On this side, you can see that a child sleeping under a mosquito net, and you shouldn't allow your skin to touch the net. In that case, you got mosquito bites. And also, there's a fumigation. You need to fumigate the area, the surrounding areas. And there's also the application of the mosquito repellent lotions to repel mosquitoes away, and also the use of mosquito coils. Then what treatment exists for malaria? In case of uncomplicated malaria, ACT combination therapy is used. And also have some home remedies, which are as follows. Crush cinnamon in pepper to warm water along with honey and drink this mixture 2 to 3 times a day. This herbal remedy is antimicrobial, anti-inflammatory, and antioxidant properties that will help in reducing the symptoms of malaria. Drinking turmeric milk will help in flushing out toxins from the body. Orange juice is high in vitamin C. Drinking 2 to 3 glasses of orange juice every day will help in building a strong immune system against the malaria parasite. To get quick relief from the fever and body ache, drink a concoction of ginger and warm water. This will help fight the infection. So with all this that we've mentioned here, the treatment of malaria and also the prevention measures, I encourage you all to use what we have mentioned here to prevent malaria. And any time you experience any of the symptoms that we mentioned here, it's wise to quickly run to your nearest health facility to get treatment. So until next time, goodbye.